It's time again for Health Monitor, the #1 program that's shows you how to live a life in its healthiest way, to improve the quality of health of life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
You're welcome back to Health Monitor, your guide to good health. Thank you so much for finding time to be with us on today's package, okay? Of course, we want to begin with assisted conception brought to you by True Care Fertility Clinics, and Dr. Ivy standing by to give you information to conceive with assistance in case you cannot conceive naturally. Then after that, we have Body Care and Dr. J standing by to teach you how to make alcohol-based home sanitizers. All right, then bring your health tips, and of course, we want you to stay with us throughout the show. All right, so let's take a break now. When we come back, we join Dr. Ivy from True Care Fertility Clinics.
It's Health Monitor, the #1 health show.
You're welcome back to the show, and this is the part where Dr. Ivy is going to be talking to you on how you can conceive with assistance in case you cannot conceive naturally. So, Dr. Ivy, I give it up to you right now. Good day, viewers at home. I'm Dr. Maury Yvier, and you're welcome to the assisted conception part of the show. For today, we are going to be talking about polycystic ovarian syndrome. This is a common hormonal imbalance amongst women of reproductive age group, and is usually as a result of increase in male hormone in a woman. However, the cause of this is unknown, but the characteristic of polycystic ovarian syndrome can affect a woman's ability to achieve conception. So, polycystic ovarian syndrome can happen can be noticed at the beginning of a woman's menses. That's the point she starts menstruating, which is at menarche. Or after a while, she may develop the condition, and it's a common hormonal problem, like I said, amongst women. And the cause is unknown. But however, factors like hereditary has been implicated, like inheriting it from one's parents or having a sibling who has this condition may present in somebody who else in that family, or maybe your mother had a kind of condition. So what are the characteristics of this condition? What are the symptoms a woman who has this condition may experience? First of all, she may have irregular menstruation, meaning that when I say irregular menstruation, I'm talking about having maybe 3 times in a year or twice a year, or just you can't predict the menstruation. You can't tell when it's going to come. So these women, they have irregular menses. They don't see their period like every other woman will see on monthly basis. So in a year, may just have 2 cycles, 3 cycles, and you don't know when it's going to come or when it's not going to come. Secondly, these women have anovulation. They do not ovulate all the time. And of course, if a woman is not ovulating, she's going to have difficulty in achieving conception. So there is also subfertility, or what we call infertility. These women that have polycystic ovarian syndrome, most of them may be obese, that is, they may be fat, and they have difficulty in losing weight. Also, they may not be, it's not about eating what you eat or what you don't eat, but they just see that they have increased BMI. But not all of them, like a great number of them will be having obesity, and difficulty in losing this weight is also associated with polycystic ovarian syndrome. Then you also have a situation whereby they have increased male hormone. Every woman has feminine hormone. We makes us women, which is the estrogen. That's why you see a woman develops breast. She has the curves, and she talks in a feminine way. These are hormones are responsible for this. Hormones are usually chemical produced by our body. Meanwhile, men, on the other hand, have what we call androgens. Androgens in a man is responsible for the masculinity of a man. That's development of beards, increased body hair, baldness, voice changes. That's why you see a woman talks in a feminine way while a man talks in a masculine way. So these hormones are responsible for the control of our physical appearances and our characteristics as male and females. However, in a woman who has polycystic ovarian syndrome, she has a level above normal male hormone in her body. Every woman should have a little bit of male hormone in her, that's androgens, and every man should have a little bit of female hormones in him. However, women with polycystic ovarian syndrome, they show that they have higher level of androgens, that's male hormone, than an average woman. So these women, they come down with, some of them may come down with development of facial hair, that's beards. Some may have deepened voice like a man. Others may have body hair, male pattern of hair distribution. You see that there's some women you see out there, you say, is this a woman or a man? A lot of facial hair, chest hair, and all of that. This may be as a result of polycystic ovarian syndrome. So these women, they have these conditions. Then they have what we call polycystic ovaries. When you scan them, when you have a scan done on them, you see that they have numerous follicles arranged in a particular pattern. In a woman, the ovary is responsible for egg storage. The eggs we have as women are stored in our ovaries, and we are born with them. However, these people polycystic, the arrangement of their own eggs, they are arranged like beads, and they are numerous, more than what you see in a typical woman without polycystic ovarian syndrome. So you see her ovaries, you have a lot of eggs, but the problem is that they do not ovulate frequently. So you have eggs, but they are domiciled in an unfriendly environment. Let me use that word. So they don't ovulate regularly. They have infertility. They have difficulty, irregular menses. They may have obesity, and they may also have facial hair distribution, male pattern baldness, voice changes. So these are things that may point at polycystic ovarian syndrome in a woman. So the most important factor here now is the infertility, because every woman desires to have her own child or children. And most people may not worry about polycystic ovarian syndrome until they get to a point where they need to have children and they have difficulty in achieving conception. So how do we help these women? What do we do about that? First of all, IVF is a very important factor when it comes to PCOS. PCOS women benefit a lot from IVF. IVF has come to solve every challenge associated with reproduction. And when I say every challenge, I mean every challenge associated with reproduction. A woman who has subfertility or has anovulation, of course, with IVF, we're going to grow her eggs, give her medications, develop some of the follicles as where the eggs are, grow the eggs, bring it out, fertilize it in laboratory with her husband's gametes, as the male gametes, and the female gamete fertilized in the laboratory, and then transfer this baby to her womb. So the issue of whether she's menstruating or whether she's ovulating does not come into play. So women with polycystic ovarian syndrome, there is hope out there. With IVF, almost every issue associated with fertility can be addressed. I keep saying this, and I want to advise every woman who has this challenge or who is facing this kind of problem, or you have a relation who is having this challenge, a friend, family friend, or you know now that there is a solution for this kind of problem. And of course, like I always tell women, with IVF, you can count on having your babies. Thank you very much, and God bless.
Thank you so much, Dr. Ivy, for that information. And please, viewers, if you want to conceive and you're finding it difficult to conceive after a year of marriage, please contact Dr. Ivy and she will assist you to conceive, all right? Thank you for watching that part. Health Monitor will return shortly.
It's Health Monitor, the #1 health show.
Memories are created daily from events, photo and video shoots. Having the perfect studio, equipment and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Acme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
It's Health Morning, it's the #1 health show.
You're welcome back to Help Monitor, your guide to good health. This is the body care part of the show, and Dr. Joe is standing by to teach you how to make hand sanitizers that are alcohol-based. According to Dr. Joe, it's actually the alcohol contained in the sanitizers that actually help kill the viruses and the bacteria, okay? So please stay and enjoy this piece from Dr. Joe.
So like they say in life, necessity is the mother of invention. So I decided to look at the formula for the hand sanitizers, and I've come up with my own formula, which actually replicates essentially the formula for some of the regular hand sanitizers. So we're not reinventing the wheel, we're simply sort of copying what they're already doing. What are we going to need? Well, it's a very simple process, I have to say. Essentially, we're going to be making an alcohol-based hand sanitizer. That's the first thing, because it is the alcohol that does the killing of the virus or the bacteria. So if you're going to make a hand sanitizer for hand disinfection, it's got to have alcohol in it. So in that respect, we've got alcohol here. So this is 99.9% alcohol, isopropyl alcohol that we've got here. The problem is that alcohol evaporates from the skin very quickly if you just use it as a rubbing alcohol, and it also irritates the skin. So to slow down on the absorption and also to nourish the skin, to stop the alcohol from irritating the skin, you need a skin nourishing agent, and that is where this comes in. So we've got glycerin here, so we're going to be using glycerin as part of the formula, and also we're going to be using aloe vera as part of the formula for preparing the DIY hand sanitizer. And to complete the recipe, you're going to need an essential oil. So in my hand here, I've got lemongrass oil here, and also tea tree oil. Now you don't need to use both, you just need to choose one. So for today's recipe, we're going to be using the lemongrass. So let's get preparing. Now another thing I should mention is this: when you're making your own DIY hand sanitizer at home, what you need to use is a bottle. Always a good idea to use a bottle, because if you prepare it in a dish, the alcohol is going to start evaporating, and then you're going to end up with less concentration of alcohol in the final product. So always a good idea to have an empty bottle that you can use, because it stops the alcohol from evaporating very quickly. So let's get started. Essentially, you're going to need the alcohol. So I think our target here is to make about 70% alcohol. So that goes in here. So I'm pouring the alcohol in here now into the empty bottle. Now the next thing is to add the glycerin. So we're going to pour the glycerin now into our bottle. Okay, so that's gone in. The next thing is to add the aloe vera. It's quite a thick gel, so you need to pump it up. Okay, so aloe vera is gone in. So like I said, we're going to be using lemongrass essential oil. So we're going to add some drops of the lemongrass into our preparation. Okay, that's gone in. Always a good idea to leave some room for mixing. So this goes in now. We're gonna close the lid, wipe the bottle because there might be a little bit of spill around it. Next thing we do is to shake it vigorously, okay? Which is why it's a good idea to leave a bit of room at the top of the bottle for you to shake it. Things come on really good. So this is it. It is ready. Our nice alcohol hand sanitizer is ready for us to use, and let's just test it out. Okay, that's it on my hands there. So apply it. Beautiful. Look at that. Between the fingers, the back of the hand, between the fingers of the back. Same thing on the other hand, between the fingers. And then fingernails, middle of the palm of your hand. Same thing on the other hand as well. Your thumb. There we go. Back of the hand to the wrist. This is beautiful. Look at my hands, and they look really well nourished. Look at that, the back and the front. Look at that, really, really good. And the bonus is that smells gorgeous, really smells gorgeous. So it's a nice one for you to try. It's a very easy recipe here for making your own homemade hand sanitizer, your own DIY hand sanitizer. And one more point to make is that your empty hand pocket hand sanitizers that you have, do not throw them away, because you need them to dispense your homemade hand sanitizer. So keep them, and then all you need to do is pour some from this bottle into the smaller bottles that you carry about, and you can use them outside of the home. You have them in your car, in your pocket, to use in the supermarket after touching supermarket trolleys and hand relays in trains. So do not discard the smaller empty bottles of hand sanitizers, because they will serve a great purpose in helping you dispense your homemade alcohol-based hand sanitizer.
Thank you so much, Dr. Joe, for that information on how to make sanitizers. I'm sure my viewers will take advantage of that, okay, and cut down on the spending, from your pocket for sanitizers, okay? All right. That is body care for you again today. We want to take a break now. When we come back, Health Monitor will definitely continue.
It's Health Monitor, the #1 health show.
The state government is gradually easing the lockdown to allow for minimal movement.
As responsible citizens, we also have our roles to play
in ensuring a safe and secure society.
I would like to encourage you to be sensitive, cautious,
and on guard for your personal state of well-being and others.
Please stay at home if it is not necessary for you to go out.
And if it is important for you to go out,
kindly protect yourselves
by observing social distancing.
Also washing your hands regularly, especially if it's a public place.
And taking your bath before relating with members of your family.
Don't forget to use your alcoholic-based sanitizer.
Avoid sharing of utensils with friends and even family members.
Make sure you take warm water regularly to keep your body warm.
Stay safe, stay at home, keep the rules.
We appreciate the immense contributions of our frontline medical personnel to minimize the casualty figures during this pandemic, while our hearts go out to those who have lost loved ones.
Join the force to beat this pandemic.
This message is brought to you by Electronic Media Content Owners Association of Nigeria, EMCOAN.
Thank you so much for staying with us so far on Health Monitor, your guide to good health. Nika is standing by to give us a piece of health-friendly tips.
Welcome to Health Tips segment, and we are going to be talking about one important vitamin that has to do with the red blood cells and the DNA. And that vitamin is vitamin B12. Vitamin B12, also known as cobalamin, is a water-soluble vitamin. It plays an essential role in the production of red blood cells and DNA, the genetic materials in whole cells. And also, vitamin B12 helps in proper functioning of the nervous system. It keeps the body nerves and blood cells healthy and protects a type of anemia called megaloblastic that can make someone tired and weak. Vitamin B12 deficiency can be sneaky harmful, and the symptoms include: number 1, strange sensations, numbness, or tingling in the hands, legs, and feet. Number 2, difficulty in walking. Number 3, anemia, which results from lack of red blood cells. Number 4, swollen, inflamed, smooth red tongue, which is also called glossitis. Number 5, difficulty in thinking and reasoning, which the doctor called cognitive difficulties or memory loss. Number 6, fast heartbeats. In order to make up for the reduced number of red blood cells, the heart starts to beat faster. Number 7, fatigue or weakness. Fatigue or weakness occurs because the body does not have enough of red blood cells to carry oxygenated blood around the body. Number 8, pale skin or yellow skin, which is also known as jaundice. This happens due to inability of production of enough red blood cells to circulate under the skin. Number 9, severe neurological and blood disease. Foods that are rich in vitamin B12 include beef, liver, chicken, fish, shellfish, eggs, low-fat milk, yogurt. Doctor can prescribe vitamin B12 supplements in form of oral tablets or an injection, especially for an individual that are on vegetarian or weight loss diet. And the vitamin B12 can also be gotten from fortified vitamin B12 cereal. I hope you have learned more about vitamin B12, and I encourage us to eat more food that are rich in vitamin B12 to help our red blood cells and our nervous system. Stay tuned. Health Monitor continues.
It's Health Monitor, the #1 health show.
Memories are created daily from events, photo, and video shoots. Having the perfect studio, equipment, and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo, and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Akme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
It's Health Monitor, the #1 health show.
Thank you, Nika, for that very informative health tip. Want to appreciate you for your time, okay? And viewers, want to thank you so much for staying with us so far on Health Monitor, your guide to good health. On this note, I want to say thank you again, my Dr. Joe, Dr. Ivy from True Care, and every other person who made this production a success. Thank you for being with us, viewers, for watching. Next time on Health Monitor, your guide to good health, we'll be bringing you something more informative, educative, and of course, to keep your health in top shape. My name is Jibe Ologe. Thank you for being with us. I'm going to catch you again next time on the show.